Inhale down and exhale up. So we're coming to legs together, neutral spine, and then exhale, we're going to come up. Inhale down. Exhale, just point the toe, keep the hips level. Inhale and exhale. Squeeze the tummy here. 4, 3, 2, and the last one. This time, we're going to go coming down to the chair pose and holding, bring the ribs in. Reach up so that the hands are in line with the shoulders and the hips. Keeping the ribs in. Let's take one arm back and forward. Inhale back and all the way round. Inhale back and all the way round. Inhale back and all the way round. 2 more. Stay down. Squeeze the pelvic floor. And then we're going to come up. Lovely. Let's do feet a bit wider than the pelvis. Inhale to squat position. Exhale, arms up above the shoulders. So we're going to come up to this position. And then we're going to come down to the squat. And then we're going to exhale. Use the tummy here. Inhale to come down. Exhale to come up. Inhale to come down. Exhale up. Inhale down. If you want to make it a little bit simpler, just come down and up and down and up here. You're going to keep the neutral pelvic position. So tilt forwards and backwards and find the middle point if you're not sure. Inhale, exhale. Or you can bring one leg up and raise the arms up. Let's do 8. 7. 6. Make sure you're not leaning back. So actually the shoulder should be over the hip here and not further back. Inhale. Exhale. Inhale. Exhale. Inhale. Inhale. And then let's come down. We're going to take the arms wide and come down to a plie. So the legs are just wider than the hips. Bend the knees and slide the back down an imaginary wall. So shoulders over hips. And then just feel for the bottom edge of the ribs. Let's flare the ribs out. And then bring them in and down towards the hips. Keep them there, arms wide. Exhale, we'll come to center. Inhale, step to the other side. Open and close. Squeeze the tummy. Squeeze the tummy as you come up and squeeze the pelvic floor in and up. Inhale. Exhale. Keep the ribs in. Nice wide elbows, actually. Exhale. Inhale. Keep the elbows as wide as the shoulders. Inhale. Exhale. Let's do 8. And 7. And 6. 5. Last 4. And 3. 2. And last time. Lovely. Coming back to parallel, so the feet are facing front and they're 2 straight lines. We're going to hug a tree and round the back. And then exhale to come back up to center. Let's inhale, raise the arms up. And exhale, bring them wide. Inhale, we'll take the arms back and just stretch out the chest. Lift the chest, hold for 4 and 3 and 2. And coming back to center. One more time, forwards to hug a tree, round the back. Exhale to come up to center. Inhale, reaching up, clasp the hands. And then coming here and bringing the arms back to stretch the chest. Coming back up to center, we'll just take an inner thigh stretch. We're going to step out to the side and bend that knee. We're going to raise the chest up a bit so that we feel a stretch on the inside of the thigh. Raise the chest up Toes should be pointing forwards. And we'll go to center, and then we'll do the other side. Ooh, a little clip sometimes when I do that. Raise the chest. Breathe into the stretch. And then center. Let's do one quad stretch. So quads and a bit of hip flexors. You can hold on to something if you want to. Otherwise, take one arm out to the side and just get the knees together. Lengthen up through the crown. I'll show you from the side. So knees together, and you're just holding that foot. If that's difficult, you could just bring the foot together. You could hold onto your trousers if that's helpful. Push the hip forward a little bit to get more of a stretch down the hip flexors as well as the front of the thigh. Lovely. Let's do the other side. So holding on with the other hand, or you can take the arm out to the side and then take the foot back. Knees together, hip forward, and lengthening up. Get taller. Lovely. And then a last stretch before we move down onto the mat to go into all fours. So let's come down here, put one hand on the hip, reach up with the other hand, keep the hips level. So don't tip the hips. As we reach over the top, keep the hip down and stack the shoulders so that they're not one forward, one back, actually in the same latitude. And then inhale, let's hug a tree again, hug a tree. And then exhale, we'll reach up on the other side and keep the hips level. Exhale, come over, nice big stretch down the side of the body. And then we'll come up, and one more time, hug a tree. Round the back, C-shape spine. And then coming back to center, we're going to roll down and walk out into all fours. So we're going to go. If you need to take a drink before you roll down, then do. We'll go inhale, prepare, and exhale, scoop the navel back, pelvic floor in and up, bend the knees a bit, and then we'll roll down. So I'm doing bent knee roll downs just to take any additional pressure off the lower back. So I'm going to come down into all fours. I've got my knees directly underneath my pelvis, heel of the hand directly underneath the shoulders. Okay. So here, we're going to do a few abdominal hollowings before we get going, and a few pelvic tilts. Let's start with the pelvic tilts and get the neutral pelvic position. So the top of the pelvis, we're going to tilt it down and then up. That pointy bit, the iliac crest of the pelvis coming down and then up and down. So here you've got an arched back. And then the other way, we'll flatten out the lumbar spine. And then we'll come to the middle point. So the middle point, that should be neutral. And then we're going to allow the tummy on the inhale to fill with air. Exhale, we'll draw the navel in and hollow the abdominals. Draw the pelvic floor as well. Draw the core engagement while keeping the middle point with the pelvis. Inhale. And then exhale. Draw the tummy in tightly towards the spine. Navel to spine. And pelvic floor. Inhale, bring the tummy down. Exhale, scoop the tummy up towards your back. Inhale down and exhale. Inhale down and exhale. 4 more times, and I'm just going to adjust slightly. Okay, so we're going to move straight into Superman. We're going to do the arms first. So I'm just going to have a look at what you're doing and just get the positioning right. So here, the heel of the hand is directly underneath the shoulder, and then the knees are directly underneath the hips. So you can think about the thighs being vertical. Imagine the trouser seam straight up here. Let's just flare the ribs out and arch the back a bit as well. And then feel the difference as you bring the ribs in, rib to hip connection. So I've got neutral spine, drawing the navel in, and soft elbows. And then I'm looking at the mat. So I'm just going to have a little look at your start position because that's quite important. So, great. Give me 1 minute. So I want you to start the Superman exercise. Exhale, opposite arm and leg lift. And then inhale, return. Exhale, opposite arm and leg lift. And inhale to return. Exhale to lift. Inhale to return. Soften the elbows. Exhale to lift. And then inhale to return. So Kelly, think about the neutral pelvic position because you're slightly raising the tail and arching the back here. That's it. So keep it there. You need to squeeze the navel in and the pelvic floor in and up. So core engagement in order to keep that neutral pelvic position as you do the exercise. Squeeze, inhale back, exhale. Another point, squeeze the shoulder blades towards one another and down to get the upper body in a good position. Squeeze the pelvic floor, squeeze the navel. Exhale to lift, inhale to return. Shoulder blades towards one another and down. So Isla, try to keep the hips level. That's the only thing that I noticed is as you lift, try not to twist the hips to the side. So imagine a spirit level on your hips. That might be one image to think of. Trying not to lean in on the other side as well. That's another way you could think of it. Inhale, exhale, don't tilt to the side. Use lots of core engagement to stabilize. Ribs in. And just thinking about raising the leg only to the line of the hip and the arm. So rather than bringing the leg up above, actually not here, but here, in line with the rest of your back. That's what we're doing for this one. Straight out to the back. Straight out to the back. Lovely. Let's go for inhale, prepare. So we're just going to come back to the all fours position. And we're going to inhale, prepare. Exhale, we're going to step one knee back and then the other knee back and squeeze the tummy. So again, we're not going to arch the back here. Make sure you're not arching. Lift the top of the pelvis a little to the middle point. Soften the elbows. 3 to 5 deep breaths here. Level 2 and 3 if you want to. You can go into a full plank. So you go inhale, prepare. Exhale, we'll step back 1 and 2 and squeeze the tummy. Keep the pelvis in the neutral position. 3 to 5 deep breaths. Shoulder blades towards one another and down. And then we'll come back into the box position and we'll sit back in child's pose. So you shouldn't get any pain sitting back in child's pose. But if you do, you should maybe have a chat
to me after the class if it's mild. But you shouldn't get anything more than mild. So you had a bit of a bad back and it's getting better now. So no sharp pains is what I'm saying. We're going to come up here and then we're going to go lift, hold for 8, 7, 6, 5, 4, and 3, 2. And then we'll start elbow to knee. Inhale, keeping the spine in neutral. Exhale to lift. Inhale in and exhale, core engagement. Inhale. So we're going to do, let's try for 16 on each side. But if you prefer, you could do 12 or 8 on one side, and then we can move over to the other side. Inhale in, exhale, lift. So we're not going to do a rounded back and then an extension. We'll actually just stay neutral for this one. Inhale, so nice long spine. Squeeze the core muscles. And when you've done your 16, you can rest again in child. You can rest in any position you like. This is one option. And when you've done your set, we're going to go for the other side. So I'm going to come back into the all fours box position, lift and lengthen other side without pushing one hip back or one shoulder back. Keep the shoulders and the hips level. Inhale will come in, exhale, extend. So we're going to go 2 sets of 8, 16 altogether. Try not to lean in on the supporting side. Try to keep your back neutral. Squeeze the shoulder blades towards one another and down. 16 or 12, whatever you did on the other side. And when you're finished, again, you have a little rest. I'm just going to walk my hands forward a bit and then round to one side. And feel the stretch down the side of the body. Just going to shift the hands to the right or the left. And then again, back into center. And round to the other side. Rest there. And then coming back in. Let's just come up onto the forearms. I'm going to clasp the hands. Clasp the hands here. Ooh. We're going to do a little rock forward, supporting the lower back with the abdominals. So I'm scooping in the abdominals here. And then I'm just going to bring the shoulders towards the hands and then back again. And then shoulders towards the hands. And back again. Nice and easy. Inhale. And keep the shoulders wide. Shoulder blades towards one another and down the back. Keep the back nice and long. Inhale forward, nice and slow for this. Last time. And then I'm going to rest again, child. Let's come down onto our backs to work the abdominals. So if you've just had a baby very recently, and you've had your postnatal check, you're just coming back to exercise. Let's do level 1. So I'm going to call 3 levels, level 1, 2, 3, but everybody's going to start from the hook lying position, outside edge of the feet in line with the outside edge of the hips. So feet and knees aligned with the hips, and then we're just going to feel for a rib to hip connection. So I'm going to put my fingertips underneath my ribs, and then I'm going to bring the ribs up towards my face, and so I'd be like this, military style. And then I'm going to bring the ribs down towards the hips and scoop the navel down, draw the pelvic floor a little, and then I've got my neutral pelvic position. So we're just going to inhale, fill the belly, exhale, draw the navel down towards the mat, draw the pelvic floor muscles inwards and upwards. So we're keeping that neutral pelvis, so that pointy bit of the pelvis, it's not back towards the mat, it's not forwards, and it's in the middle point, and then your ribs are down towards the hips. So you've got neutral pelvis and a rib to hip connection. Inhale, raise the belly, fill the lungs, exhale, draw the navel down, draw the pelvic floor, reduce the pelvic cavity, the space in here, draw the ribs in, draw the navel down, draw the pelvic floor in and up. You can imagine there's a cube inside your pelvic area, and as you breathe out, you're going to squeeze the cube and make it smaller. So we'll inhale, expand. Expand the ribs, expand the belly, exhale, draw the navel down, draw the ribs in, draw the pelvic floor. We'll put the hands down now, and we'll inhale, prepare, expand. Exhale, we'll bring one leg up to the tabletop position while squeezing in with the ribs, drawing the navel down and drawing the pelvic floor. Level 1, we're going to inhale and tap one toe down, keeping the pelvis in that middle point, the neutral point. Exhale, we'll bring the leg up. Inhale, we'll tap that one toe down. And exhale, squeeze the core muscles. Keep the ribs down. Inhale, we'll tap the toe. This is your level 1, just starting back out. Inhale. And you should feel that sense that the abdominals are doing the work. On the out breath, you're squeezing that cube inside the pelvis. Inhale, exhale. So you could do 8 or 12 of those, or even 16 on each side. Level 2. So level 2, we'll take one and then the other leg to tabletop while maintaining the neutral pelvis and the rib to hip connection. Wide shoulders. Inhale, one leg slowly down. Exhale to come up. This is a lot harder and it takes a bit of concentration. Just keep imagining you're trapping a butterfly under your lumbar spine, just to keep it down there, but without crushing down into the mat. Let's keep the pelvis in the neutral middle point. Inhale down. Exhale up. Inhale down. Exhale up. And have a little look. Level 3, you can bring the arms up at the same time. Inhale down. Exhale, squeeze the core muscles. Great. Keep the shoulders nice and low. Keep the ribs down, Isla. Brilliant. Big breath out. So we'll have a little rest, but if you're level 3 and you want to go straight into the next exercise, single leg stretch, then you can go straight in. Otherwise, I'll show you. So level 1 and 2, we'll start in the hook lying position. Just check you've got a neutral pelvis tilting back and forwards and in the middle point, and then we'll place the hands down. We'll come up to tabletop 1 and then squeeze the core muscles to come up number 2. And then you bring the knees a little bit wider, toes towards each other, so toes together, a bit like that. And then keep the lower back close to the mat. We'll extend one leg out and then exchange and exchange. Each time a breath out, keep the whole upper body still and center. Squeeze the core muscles. Each time a breath out, squeeze the pelvic floor in and up, both sides. So when you squeeze the pelvic floor, you can imagine stemming the flow of urine and a bowel movement at the same time. And that should give you the right action. Each time a breath out, squeeze, squeeze. Like you're blowing up a balloon. Keep the lower back down. So level 3 is if you've if you're working in a curl because you're not postnatal anymore, then make sure you're properly up. So head and shoulders, bottom edge of the shoulders on the floor, and then try not to tuck the chin too much. Great. Let's do 8 and 7. Keep going. 6 and 5, 4 and 3, 2 and 1. Inhale, prepare. Exhale, come to tabletop and put the legs down on the out breath. 1 and 2. 1 and 2. We'll go into glute bridge. So just bring the feet a little bit wider than the pelvis. And then just get comfy on the mat. Neutral spine, so we'll get a neutral pelvis to achieve that tilting back and forwards, and then finding the middle point, we'll place the hands down. 1 and 2, and keep the back in that position. Imagine arrows going straight up through the hips. We'll come up to here. Squeeze the glutes rather than lifting the lower back. Inhale to come down. Exhale, squeeze the glutes. Inhale to come down. So we're doing a glute bridge. Level 2 and 3, if you want to, bring the arms up overhead, over the, above the shoulders, palms face each other. Keep your rib to hip connection, so try not to flare the ribs up, keep them down, and then keep the lower back in neutral as you come up and down. Squeeze the pelvic floor a little, about 30% core engagement as you come up. Let's do 8 more. 8, 7. If you want to rest, just have a little rest. 6 and 5 and 4 and 3, 2, and last time. Let's bring the arms down and just bring the feet back to parallel. We're going to do one more exercise here, keeping the pelvis in neutral. So we're going to tilt back and forwards, and then find the middle point here. Middle point, neutral pelvis. Inhale, we'll bring one arm. So one arm's down and one's up. And then we're going to squeeze the core muscles to change over. Nice and slow. Squeeze. Try to bring the arm all the way back without losing the rib to hip connection. So you could go inhale to here and then exhale to lower down. Inhale, exhale. Squeeze the core muscles. Keep the shoulders nice and low. Use the core muscles to move the arms. Two more times. And then we'll bring that arm down. We're going to come over onto our sides, coming up onto our sides on the forearm. with the elbow down on the mat, directly underneath the shoulder. Let's take a little stretch here. So we're going to turn the top leg up and reach up, lift the hips up and stretch over. Inhale, let's come down. So actually, I like to inhale when I come up and exhale, come down. Inhale to come over. Keep the hips and the shoulders stacked. Exhale to come down. Inhale. Reaching over. Exhale to come down. Inhale, reaching over. Exhale to come down. I'm just going to reach up along the line of the body here, and I'm going to touch the back of the shoulder and then get the shoulder pointing in that diagonal line with the body. Get the elbow pointing in that diagonal line. Stretching out the tricep. And then release down. Let's come down onto the mat and we'll do the clam shell exercise. So here, you need to have a rib to hip connection. So I've got my knees in front, and then I'm going to bring the ribs in and down towards the hips. You'll notice a bit of a scooping in the abdominals there. So I'm going to suggest that you could either keep the feet down or put them up in the air. So here it is down. So we're just going to open the knee and squeeze the tummy, squeeze the pelvic floor, level one. Inhale down, exhale. Imagine you're skewered through the hips into the mat so that you're not leaning back as well. You just stay in that position, lift a bit and squeeze the tummy, squeeze the pelvic floor. Inhale down, hands in front, support nice wide shoulders. Exhale, keeping the ribs in. Inhale down. And then level 2 and 3. If you want to, put the feet in the air. You could put the arm in the air as well. Palm faces front. Exhale to open. Inhale to come down. Exhale, squeeze the core muscles. Inhale down. So I'm going to do 16 of these because I'm feeling good today, but you might want to do 12 or 8. Just see when you fatigue, you can count how many you're doing and do the same on the other side. Inhale down. Exhale to squeeze the core muscles. Inhale to come down. So this is good for your abductors, glute medius, and IT band. When you've done your 16 or 12 or 8, whichever you've decided to do, we're going to do something for the adductors, the inside of the leg. So I'm going to extend the lower leg, and then I'm going to place the top foot over the top. So I'm just going to put my foot there, and I'm going to keep my ribs in and squeeze the tops of the thighs together and then lower. Squeeze the pelvic floor and the tops of the thighs together and then lower. Squeeze the pelvic floor and the tops of the thighs together and then lower. So I'm going to do 12 of these. Squeeze the tops of the thighs together, keep the ribs in and then lower. Try not to move the rest of the body. Use the core muscles. And then when you've done your 8 or 12, we'll release the legs down 1 and 2. We're going to come over onto our fronts and do a little exercise here. It could be tricky if you haven't fed the baby for a while with the breastfeeding. Otherwise, I'll show you now, perhaps you could try later or on another occasion, but this is really good for the upper back. We're going to do swimming, but we're going to do it in neutral. So often you'll see people doing it all the way up there. We're going to stay down here, just slightly off the mat. So face slightly off the mat, feet a little bit wider than the hips and feet floating off the floor. Again, arms are floating off the floor. And I'm going to go, exhale, opposite arm and leg lift, inhale down, opposite arm and leg. So I'm squeezing the core muscles as a priority. Navel in, pelvic floor. Big squeeze, rib to hip connection even. Follow the abdominals. 8, 7, 6, 5, 4, 3, 2, 1. Let's do the fast one. 8, 7, 6, 5, 4, 3, 2, 1. And release down. Hands under the shoulders. And then we're going to push back into child's pose. So I'm going to push my bottom up into the air. That might be difficult, so only do it if you think you can manage today. And come back to child's pose. Fabulous. We're going to do the other side of the leg. So I'm going to change position. So we started off with a mermaid stretch. We put the elbow underneath the shoulders, stack the hips, and then turn the top leg up. So we inhale and lift the hips up. And then exhale, we'll bring the knees back to the front. Inhale, we'll lift up, hand over, keeping the ribs in. And then exhale to come down. Inhale about 6 times. And exhale. Nice and slow. Imagine you're between 2 panes of glass about a foot wide. So you don't move out of that line. Keep the ribs in. Last time. And then we're going to stretch the tricep here. So I'm going to get the crown of the head and the tail in a line and then reach along that line, touch the back of the shoulder and bring the elbows straight up on that diagonal line. Stretching out the tricep. And then I'm going to come down for our clam shell exercise. So palm, this palm is down on the mat, stack the shoulders and bring the lowest edge of the ribs in towards the hips, level 1. Just a small opening with a squeeze of the tummy and the pelvic floor muscles inwards and upwards. Inhale down, exhale to lift. Inhale down. Level 2 and 3. So you could have the legs up and just do this. So I'm doing 16, or you could do 12. Whatever you did on the other side, do the same. Yeah. So I've got my palm facing front directly, you can see, directly above the shoulder. Try to keep the core engagement going. Really good to keep the positioning for this. So that's how it works best. Quite difficult if you've got a baby climbing all over you. So well done. Got to try. And get a bit of entertainment at the same time. Inhale down, exhale, nice and slow. Oh. So slow is better for this kind of thing. and get the muscles under tension for a bit longer. So once you've done that, we're going to work the inner thighs. So that was the abductors, and now we're going to do the adductors on the inside. So we're lying down with one foot in front, and you're going to try to keep the hips stacked one on top of the other, and shoulders again stacked one on top of the other. Keep the ribs in, palm face down on the floor above the head, and then we're going to squeeze the tops of the legs together and the pelvic floor as well. Bit of core engagement. Exhale. So I'm going to do 12. So if you're slim and you've got a bit of a bony hip, you may find you need to use a bit more mat underneath you. So you might want to fold the mat, depending on how your hips are feeling, if they need a bit more of a squidgy surface. Oh, yeah. Squeezing the tops of the thighs together and squeezing the pelvic floor. And when you've done your 12, we'll come back to the start position. So we're going to come back, let's come back onto our backs for a little bit more abdominal work. So we're going to do level 1, 2, and 3 again. We're going to do the 100, so we're going to go feet and knees aligned with the hips, and then just get a neutral pelvic position. Exhale, tilt back, and then we'll tilt forwards, then find the neutral point, arms down. We're going to inhale, prepare, exhale, level 1, just take one leg up to the tabletop position so that the knee is directly above the hip, and then we'll raise the arms off the mat, and we'll keep the elbows ever so slightly soft. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Trying to keep the knee on top of the hip, trying to maintain the neutral pelvic position. Keep the ribs down. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. That's one set. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. 2 sets. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. So you do 5 sets on each leg. Level 1. Level 2, you're going to be in the tabletop position. Trap a butterfly under your lumbar spine so your back doesn't move away from the mat, but it's not crushing down. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Inhale, 2, 3, 4, 5. You could bring your legs straight up. Inhale, 2, 3, 4, 5, or out at an angle. That's the hardest. When you've done 10 sets of inhalations and exhalations, we'll bring the knees in towards the chest. I'm just going to rock gently from side to side a couple of times. And then I'm going to bring the arms wide on the mat. Inhale, prepare, and exhale. I'm going to bring the knees down to one side. And look to the other direction, stretching out on the mat, arms in a T shape with the shoulders. If you want to, you can extend the top leg towards the hand and get a stretch down the side of the buttock and the hip as well. So I'm looking to the opposite direction. And then I'm going to bend the top knee again. Exhale, I'm going to squeeze the core muscles to bring the knees back into center. And rest there for a moment. Inhale, prepare. Exhale, I'm going to bring the knees down to the other side and then look towards the other hand. So again, if you want to extend the top leg towards the hand, you can. And then And you bring the knees back in using the abdominals. Lovely. I'm going to come up to a glute bridge here and hold for 8, 7, 6, and 5, 4, and 3, 2, and 1. I'm going to bring the arms up overhead and hold for 8, 7, 6. You could keep the arms down here if you prefer. I'm going to keep them up here, squeezing the glutes. And now I'm going to do something, I don't usually do spinal mobilization, but I'll do a couple. I'm going to inhale first and then exhale. I'm going to roll the top of my back down first, followed by the rest of the back, vertebra by vertebra. So this time I'm not keeping the back straight. When I get down here, I'm going to tuck the pelvis back a little and then roll vertebra by vertebra as I bring the arms up overhead onto the floor. Inhale, prepare, and exhale, roll my back down. This top part comes down and then the bottom part comes down. Inhale, prepare, exhale, tucking the tail for this, and then we're going to come up vertebra by vertebra. The vertebrae actually move together in sections, so it's not quite vertebra by vertebra, but that's the idea, like a kind of string of pearls. Okay, so we've done a couple of those. We're going to come up to tabletop position. So feet and knees aligned with the hips. We're going to do a little bit of abdominal work, as I promised. So one leg in tabletop for level 1, 2 legs in tabletop for level 2. Keep your lower back down. Inhale, we're going to bring one leg down, level 2. Exhale to come up, level 1. Inhale, we're going to come down, and exhale to come up. So I'm just going to show you the feet because they start pointed, and then as I bring the leg forward, I'm going to pull the toes back towards me and bring the heel towards the mat. And then I'm going to scoop the navel down and the pelvic floor to bring the leg back up to tabletop. Keep the lower back close to the mat. Inhale to come down. Exhale to come up. So level 1 you could do 8 to 12 on each leg. Inhale down. Exhale, squeeze down towards the mat. Level 2, keep the butterfly trapped under your back without killing it, without crushing it. So you've got to keep your lower back down. Inhale down. Exhale up. Inhale down. Exhale up. Level 3, bring the arms up as well. Inhale down. Exhale up. Level 3, you could try opposite arm and leg. The arm comes back overhead. Just make sure you're not lifting your back up and out of neutral. So you could do 8 or 12 of those. Level 1, you're here. Inhale down. Exhale, squeeze the ribs and draw the navel down, draw the pelvic floor. Inhale down. Exhale up. Inhale down. And exhale to come up. Ribs in, like a corset's going on. Inhale down. Exhale, ribs in, navel down towards the mat, and my pelvic floor muscles inwards and upwards. And then we'll finish back in the hook lying position. We're going to scissor the legs now. So keeping the lower back in neutral, exhale 1, and then 2 legs up to tabletop. We'll extend the legs up and the arms up. Just push your lower back gently in towards the mat without crushing down. We'll just scissor the legs, hold behind the thigh, not the knee, and then scissor again. Scissor, pull, pull. Let's do pull, pull, squeeze, squeeze. Squeeze the pelvic floor. Try to keep the legs straight. You can point the toes. So level 1, just a small scissor. Keeping your lower back down is the main priority. Keep it, imagine gluing your lower back to the mat. And keeping the pelvis in that middle point. Use the pelvic floor. Let's do 8 if you can, otherwise rest. 6, 5, 4, 3, 2, 1. Coming back to tabletop and then exhaling the legs down. 1 and 2, and then we'll come back up to glute bridge and hold for 8, 7, 6 and 5, 4 and 3, 2 and inhale to come down. We'll do one more. Coming up, squeeze the glutes. 7, 6 and 5, 4 and 3, 2 and then inhale to come down. Lovely. Coming over onto our sides, coming up to sitting. We'll do one more thing on our forwards. We're going to soften the elbows and get into this nice all fours position with the shoulder blades towards one another and down. Just check you're not blowing the ribs down or dipping the pelvis into the neutral position. And then we're going to come up. Inhale, prepare. Exhale, curl the toes under and then lift the knees a tiny bit off the mat. Squeeze the tummy in towards your back. Squeeze the shoulder blades towards one another and down. 3 to 5 deep breaths. And when you're ready, come down. You can rest here or in child's pose, it's up to you. We're going to do that 3 times altogether, and on the third one, we're going to progress. You don't have to progress, or you could just do 2 times altogether. So this is the second time. Hands directly underneath the shoulders, curling the toes under. Keep the pelvis in neutral, and then we're going to come up and squeeze the tummy. Squeeze the tummy in, squeeze the pelvic floor. 5 deep breaths. And then come down and resting. On the last one, if you want to progress, we'll bring the foot into a kind of tabletop position, put the footprint on the ceiling, so I'll show you. Inhale, prepare, and exhale, we'll come up. Knees are only a couple of inches off the floor maximum. I'm going to put a footprint like this on the ceiling. Inhale, down. I'm going to squeeze the core as I do it. Just move so you can see. So try that 4 times on each side. And then rest. If you want to do one more set, you can. We'll come up and then 1, 2, keep the other knee close to the mat. 3, 4, and resting down. Really squeeze in and lift that leg up. Squeeze in with the navel. Don't arch the back. Lovely. So we're going to come in for a hip flexor stretch. We'll do a hip flexor stretch and then a hamstring stretch. So the hip flexor stretch will come up to a kneeling position like so. We're going to bring the front knee over the ankle and increase the distance between the legs, between the thighs. So I'm going to hinge forward so that I get a stretch in the front of my hip on the side where the leg is behind. I'm going to go like this. So the knees are still hip width apart. And here, I think I'll take my hands back and stretch the chest at the same time, but you don't have to. You could have the hands here for support. Try not to overly arch the back. I'm pushing the tail down and I'm stretching the chest at the same time by bringing the elbows directly back. And then I'm going to bring the hands onto the front of the thigh and pull the toes back towards me to stretch the hamstrings. So this is the lower part of the hamstrings. If you want to get more of a stretch, you can bring the hands down, or if you feel comfortable too, you can sit back on the heel. It's up to you. Whatever feels comfortable with stretching. We're not going to overstretch at the moment, particularly because you're postnatal. So I'm going to bring that leg back in, and then I'm going to take that leg out to the side. So 3 stretches on one side, and then we'll do the other side. So that leg out to the side. I'll show you from the front so that you can see. So I've put my toes to the front, and I'm stretching the inner thigh here. Stretching out the inner thigh. And then I'm going to bring the leg back in. I'm going to stretch the other side of the other hip flexors. So I'm going to bring the leg out to the front. Knees are hip width apart, feet are straight. And then we hinge forward to get the front of this hip. I'm going to put the hands here. But if you want to, you can get an additional stretch in the chest by bringing the hands down, push the tail down and squeeze the elbows back, lift the chest. So the knee directly on top of the ankle. And then I'm going to come back and we'll bring the hands to the front. And I'm going to lean forward. It can be a bit tricky. You might want to put your hands down or just be quite upright and pull the toes back towards you. It's up to you. Try and feel the stretch on the back of the thigh, the hamstrings. And then we'll come back to this position. So get back to the all fours and take the leg out to the side. I'll show you from the front again. So I'm going to just take the leg to the side. So the toes are pointing to the front and stretching the inner thigh. I'm just going to come back to sitting and stretch here in the upper body before we finish up. So arms out to the side, sitting up nice and tall, up through the crown of the head, and then we're going to take the ear down to one shoulder. Keep the shoulders level. And then I'm going to turn and I'm going to look down under the armpit before coming up to center. Again, inhale, reaching up through the crown of the head and then taking the ear down to one side. Sitting up nice and tall. And then I'm going to look down and under this arm before looking back up and back to center. And stretch up. Interlace the fingers and bring the arms up. Lovely. I'm going to roll up with bent knees now. Come close under. Get to this position. Squeeze the tummy in and keep the knees bent. Head comes up last. When I get to the top, I'm going to pedal the feet. Pedal the feet, knee forward, knee forward. I'm going to reach up, bring the arms up overhead and then down, reaching up, and then down, reaching up, and then down. Well done. Really good. I'm going to stop the recording